Hi everyone, this is Cindy Crook. I'm the Director of Marketing here at Duncan Regional Hospital, and welcome to this month's Facebook Live. October is National Breast Cancer Awareness Month, so we thought it'd be great to have two experts here. Tabitha Wade, I almost called you Crystal Wade. Tabitha Wade, who is the ultrasound team lead, and Crystal Sorrell, who's the imaging center team lead, talk to you about breast health and what we offer at our imaging center. So ladies, welcome and go ahead.
Thank you. Thanks, Cindy, for giving us this opportunity to talk to everyone. So like she said, October is Breast Cancer Awareness Month. So this has been around for over 30 years. It was actually founded in 1985. And this yearly campaign is designed to educate people about the importance of early detection and testing. And that's mostly what Tabitha and I will be talking about, is the importance of early detection and the testing we offer here at DRH Imaging.
So you should know that breast cancer is the most commonly diagnosed cancer in women, and it's the second leading cause of cancer deaths in women. On average, every 2 minutes, a woman is diagnosed with breast cancer, and every 13 minutes, a woman dies from breast cancer.
And so, although breast cancer is obviously much more rare in men, we don't want to forget about the men, though, in October. So we want everyone to be aware of their breast health, men and women. An estimated 2,500 men will be diagnosed with breast cancer in the U.S., and unfortunately, approximately 500 will die in the U.S. this year of male breast cancer.
That's right, but thankfully, because of the increased awareness in the month of October, death rates from breast cancer have been declining since about 1990. So the Breast Cancer Awareness Month was founded in '85, and since 1990, they've been declining, and they've actually been declining about 40% since 1990.
And so that's a great stride to cut the death rate from breast cancer almost in half since October became Breast Cancer Awareness Month. This is mostly in part due to the better screening and early detection, increased awareness, and of course, continually improving treatment options. Of course, technology just gets better and better in every field, but especially in the medical field, we're always making advances.
That's right, thank goodness. And 3.3 million women are alive today in the U.S. because of these breast cancer awareness.
Mm-hmm. And although they're making great strides, there's better detection, better treatments, we still can't become complacent about our breast health because 1 in 8 women in the U.S. will be diagnosed with breast cancer in her lifetime.
Can I ask a question?
Sure.
Regarding the men and breast cancer, men don't get annual mammograms.
No, they don't.
So how would a man even be diagnosed with breast cancer?
So men, just like women, you need to be aware of what your breasts are like, because everyone's different.
Mm-hmm.
Some people are lumpy and bumpy. We're just all different shapes and sizes. You have to know what's normal for you. And but so if a man feels anything, usually a lump, any skin changes in that area, nipple discharge, anything that you're worried about, see your healthcare provider for it. And then the doctor would order a mammogram for the man. So no, men don't come for yearly mammograms. If they ever find anything suspicious, the doctor can send them for a mammogram.
We just want to reiterate that men do get breast cancer, and it isn't uncommon.
Thank you.
So even women 50 and above, even skipping just one mammogram for every other year would actually miss about 30% of cancers. And we have an example of a patient who skipped her mammogram for 6 years, and we want to show. Crystal, you want to elaborate on that?
So here, this is a woman who came to DRH Imaging, and this is her mammogram from 2013. And it was read completely negative, meaning there were no suspicious findings. So you can see, I'm not sure if you're familiar with mammograms, but there is some density in this area that's completely normal. We'll talk about breast density more later on in detail. But this mammogram, completely normal in 2013. We don't know why, but she skipped her mammogram for 6 years. So this is her 2019 mammogram. And unfortunately, she had a very large cancer. She has a good prognosis. Of course, she's getting treatment and going through all the steps she should. But of course, if she had come even 2 or 3 years earlier, they could have caught it sooner. But obviously, if she hadn't been skipping mammograms, if she'd come every year, they could have caught it when it was much smaller and easier to treat.
And that's the importance of early detection. And so that kind of brings us into what we provide here at Duncan Regional Hospital in terms of our services for breast health.
Mm-hmm. So at DRH Imaging, we offer the latest 3D mammography. And most breast imaging centers in Oklahoma do offer 3D mammography. There are only maybe 2 or 3 in Oklahoma that still offer the older 2D. But we do have the latest 3D mammography. We've offered that since 2014. We also offer screening breast MRI, screening breast ultrasounds, and when needed, stereotactic biopsy and ultrasound-guided biopsy.
That's right. We also want to provide services for patients who can't make it in necessarily Monday through Friday, 8 to 5. So we are open occasional Saturdays, and we open extended hours in the morning. So if you can't make it Monday through Friday, 8 to 5, we do offer those extended appointments. We also want to make sure everybody can afford a mammogram, and there's actually an Affordable Care Act that requires all Medicare and private insurances to pay fully for a screening breast mammogram. But if you don't have insurance, we do have a self-pay case rate of $175, and that's the whole
That covers
shebang.
the radiologist. The $175 covers the radiologist fee and all your fees at the imaging center. That would be payable at time of service, the $175, but that's a good savings. Make sure, we want everyone to have their mammogram, even if you don't have insurance.
Absolutely. And just to reiterate, you do not need a doctor's order for a screening breast mammogram. I mean, people ask that a lot, quite frequently.
And when we're saying screening mammogram, we're referring to the yearly mammogram. That's just your yearly checkup type. It's when nothing's going on. You just want to have it every year. That's what we mean by screening mammogram.
So don't forget, annual screening mammograms catch cancer early. It's the best form of defense for that early detection.
And how old do you need to be?
I'm
sorry.
we were almost there. That's fine. The American College of Radiology, or the ACR, recommends that women 40 and above begin their basic screening mammograms.
Even if you have no family history or no symptoms of cancer. So every woman, age 40, you start having your yearly mammogram. I've talked to some women, patients, or just friends, because I'm kind of one who preaches to my friends and acquaintances. Make sure you're getting your yearly mammogram. I kind of ask them if they've had it done recently. And I hear a lot of times women say, well, no one in my family has had breast cancer, not anyone. So it's not important to them. But something really important to know is that 3/4 of women diagnosed with breast cancer have no family history whatsoever of breast cancer.
So that's 75%.
75% of women are the first woman in their family to have breast cancer. So you absolutely cannot skip your yearly mammogram just because you have no family history.
So start at age 40, even with no family history. Very important, because mammograms show changes in the breast up to 2 years before a patient can actually be symptomatic or feel any changes.
That's when you want to find a cancer, is before you have a noticeable symptom like a large lump, skin dimpling, or changing nipple discharge. It's easiest to treat cancer when we find it before that.
Right. Because breast cancer typically shows no symptoms. So you won't have those symptoms when you actually have breast cancer until it's further progressed with the disease. So we want to catch those early for sure.
So even if you do have yearly mammograms, you should know how your breasts normally look and feel. Like we were saying earlier, everyone's breasts are different. We're all shapes and sizes. So what's normal for me may not be normal for Tabitha. Some people have what we call like kind of lumpy, bumpy breasts, and that's normal for you. But you want to know when you have a new lump or something that's larger that feels just, something you're worried about or suspicious about. You don't ever want to just put it off and think, oh, it's nothing, it'll go away. Let's say you have your yearly mammograms every June and you feel something suspicious in December. Don't wait till the next June, till your yearly mammogram. Go to your doctor, tell them, hey, I'm worried about this. Can we check it out? And we may get you in for a mammogram sooner than your yearly mammogram because we don't want to wait, any time at all. We want to catch this as soon as possible. Right. But like we said, my normal may not be someone else's normal. So just be aware of how they look and feel. And if you feel something different or see something different, talk to your healthcare provider.
And because of that individualized care, one thing that is normal for one person and not normal for the next is breast density. And that leads us into our next topic. So 40% of women have dense breasts. And I'm going to show you an example of what dense breasts look like. So Crystal's going to hold, there are 4 categories of breast density, A, B, C, and D. Can you see that? Okay. So Crystal has category A and B. So A, you can completely see everything in the breast. It's like a clear day.
Cloudless sky.
Cloudless sky, right. And so I'm holding C and D, and you can see that it gets a little more dense as we progress down the categories. So anyone with a category C or D on your mammogram report, it will actually list that you have heterogeneously dense breasts. And so that means that we like to take the extra step to order either a breast screening ultrasound or a breast screening MRI to look through that dense tissue and make sure that there's nothing hiding behind those clouds, if you will, with that dense breast tissue.
When did they start putting that on the mammogram?
That was about October 2017 that was required to be added to every mammogram report if you had category C or D breast density.
So other than your mammogram saying if it's negative or benign, there's nothing there to worry about, you also want to pay attention to what she was saying, the breast density category. They're only going to list it when it's C and D. And when it is C and D, they recommend another step. So I had my screening mammogram this year, and I'm category D. I'm extremely dense. And I don't know if we talked about this, but breast density has nothing to do with your age, your weight, your breast shape, size.
Family history, nothing.
It's random. It has nothing to do with any of that. So you can only know if you have dense breast tissue by having a mammogram. So I was category D, and so I decided to go the extra step and have my screening breast MRI, which was, pretty quick. I think it took me about 20 minutes total, and luckily that was completely negative too. So, again, I'm got the final word that, my breast density issue, not anything to worry about this year.
Right.
Going to keep doing everything next year. I can't, be complacent and skip a year.
But we also want to reiterate that having high breast density is actually puts you at greater risk than having two family first degree relatives with breast cancer. So having high breast density puts you at more risk than having a mother and a sister that both had previous breast cancer.
That's why it's important to look at those density categories on your mammogram report.
Which brings us to our next subject, is genetic testing. So if you do have a mother and a sister with previous breast cancer, and you're concerned, well, what does that genetically predispose me to? We offer a service here at Duncan Regional to assist you with that.
Right.
And
so I'm sorry. Every mammography patient at DRH Imaging is screened for your genetic risk factors. That's free. It's a service we offer. And so we do that by working with Myriad Genetic Testing. They have been around since 1991. They actually invested over $300 million in research in just the last 5 years to research genetic risk factors.
Right. And so every patient is screened, like she said, when they come in for a mammogram. We also have a nurse navigator. Her name is Janet Whitecotton. She is wonderful, and she will assist patients through any amount of breast imaging that they have to have. Anybody that needs a follow-up or has dense breast, she follows all of those patients. She's wonderful. She's a wonderful resource, and she knows how to obtain resources for patients who have questions or issues. She is a great asset to us at Duncan Regional. But she handles all the genetic screening through the Myriad. Myriad, the company she was talking about, is a great company. It's been around a long time, and they actually test for 35 different genes.
Right, so this is not just for breast cancer gene testing. They look at 35 different genes that affect a lot of different cancers. And I wanted to say we worked with Myriad Genetic Testing since 2014. And just another service we want to offer to make sure you're, have the best idea of your health overall.
They also screen 8 different cancer sites. So 35 different genes, 8 different cancer sites. So even if you don't have daughters, because some patients say, well, because I don't have a daughter, I may not carry that gene down to her. It's eight different cancer sites. So it affects males as well. Prostate cancer, pancreatic cancer, and we'll list some of those later. But it's
and a man, your son could be a carrier of the breast cancer mutation, the BRCA1 or 2, who could pass it on to their daughter. So this affects all of us. It's not just women. I should say even mutations in the BRCA gene, the breast cancer gene, they're even associated with ovarian cancer, prostate cancer, pancreatic cancer, and they test for the gene mutation for some colon cancer. So it really gives you a broad picture of your overall health, not just breast health.
Just the cost of the genetic testing. If you are at high risk or if you are determined to have high risk factors, most insurances will cover about 97% of the cost of that genetic testing. If you don't have risk factors, but you just want to know what your genetic predisposition is, then they offer a financial assistance program through Myriad.
But they want, Myriad's goal is they want everyone to have this test that needs it or really wants it done. This is another test I had this year myself, and fortunately had no genetic mutations, but my insurance covered it fully. And like she was saying, they even have monthly payment plans. They just want to make sure everyone can have this test if they need it.
Okay. Well, and also if you are determined to have the BRCA1 or the BRCA2 gene, it actually gives you a higher risk, about 5 times greater than a normal risk of breast cancer, and about 10 to 30 times greater risk for ovarian cancer. So it can really give you some good information and be a good resource for you for preventative health.
Okay, so I think we've covered all our information. So we want to address some questions now. And if there's any coming across on the Facebook feed, but we've also got some questions here that we just hear a lot of times from patients or family and friends. They want to know more about this, things that are confusing. So we're going to cover those now.
So one of those questions that's most frequently asked is, do I need a mammogram every year?
Yes, you do. Like we said, the American College of Radiology recommends starting at age 40. You never skip a year, whether you have symptoms or not, you have it every single year.
Okay, and so it does start at age 40. Is there an age that I should stop getting my mammogram?
There is not. There's not an age they say that's the cutoff range. It can be a personal decision if you're getting, older. That's between you and your healthcare provider. But the American College of Radiology does not give a cutoff year. It's every year starting at 40 from then on.
Okay, and if I have a strong family history, should I be getting mammograms at 40 or earlier?
Possibly earlier. That is, again, we say this many times, talk to your healthcare provider. If you have a strong family history, say your mom had breast cancer at age 44. A lot of times the norm is to start 10 years before she was diagnosed, so you would start at age 34.
Perfect. Do I need an order from my doctor to schedule my basic routine screening mammogram?
No, you don't. No, for your yearly screening mammogram, a woman does not need an order. A man does need an order if he feels something abnormal, and or if you feel something abnormal and it's not time for your yearly mammogram, but you feel a lump or something, you would need an order for that from your doctor.
And then another frequently asked question is, if I get my mammogram and I get called back for additional images, does that mean I have cancer? Should I be concerned?
No, we have a lot of women worried about that, understandably, because there's something on their screening mammogram the radiologist is not 100% sure of. So if they are not 100% sure what it is, you will get called back to have what's called a diagnostic mammogram or a diagnostic breast ultrasound.
And sometimes they do both. And so it's basically a focused imaging. So we're going to focus in on the mammogram. We're going to look at a particular spot that he was questioning. And then the ultrasound is also a focused ultrasound. So you're not getting a complete screening of both breasts. You're getting a focused spot area test.
Yeah, I have had some patients ask me, they said, are we just redoing what we did before? And we're not. We're doing, like she said, a focused area, the area of concern. We may magnify it. We might add extra compression to that area so we can get, the best picture of that.
Absolutely.
We also get asked, so after your diagnostic mammogram, your diagnostic ultrasound, let's say they still aren't sure what it is. The only way to know for certain whether it is or is not cancer is a tissue sample, which is a biopsy. And so if I call back for those, does that mean I have cancer? If I have a biopsy.
Under stereotactic biopsy, under mammogram, or we do those under ultrasound guided biopsy in the ultrasound room. And either way, we're just getting a piece of tissue to send off to pathology to be sure 100% whether that area of concern was cancer or not.
And of course, understandably, the patient can be very worried if they are called back for a biopsy. The great thing here at DRH Imaging, Dr. Nathan L. Frank does all of the biopsies. He is wonderful. He loves talking to patients, making sure they have all their questions answered, make sure they know all their options, what we're doing. He's not going to rush you through that. He's going to make sure you understand what we're doing and why. And again, the patient's understandably nervous, but he does a lot of these. He's excellent at them. And they take a little less than an hour, depending on maybe 45 minutes to an hour. They can be done in the mammogram room, like she said, or the ultrasound room. You're not sedated. We recommend you come with a family member or friend just for moral support usually. And you leave with kind of basically a large Band-Aid. It's actually, a pretty simple procedure, even though you are very nervous about it.
And patients' anxieties run really high with those biopsies. And we have Janet White-Cotton for a reason. She helps these patients tremendously. She walks patients through the process. If the diagnosis is cancer, she will take that patient and give them every resource available and show them where they need to go, what their next step is. And it's a journey for sure. And she takes them step by step through that.
I think we've addressed all the questions we frequently hear. If there's not any other questions, Cindy?
I just had one.
Okay.
You talked about the 2D and the 3D. What's the difference?
Okay, so 2D, 3D. 2D images, we normally get 4 images of the breasts during a normal screening mammogram, 2 on the left, 2 on the right. And 3D mammography, it takes just a few seconds longer than a normal mammogram, but it basically gives, tomo means slice, it gives the doctor sliced images. So especially with dense breasts, it's wonderful because it's like trying to see through that cloudy sky. It gives them
An extra added dimension to look through that breast. So it's very beneficial, especially for dense breasts.
And also, aren't we a breast center of excellence?
yes, we
Could
are.
you tell them about that?
Well, there's lots of criteria to meet. Janet, I think, spearheaded that, didn't
Yes,
she?
she
Our
did.
nurse navigator spearheaded that to make sure we were qualified to be a breast center of excellence.
Great. No more questions.
Any other questions?
Well, ladies, I'm in again.
Okay.
You guys have been, this has been really great, and this will play out on social media for a long time, so you'll be stars. So, thank you, everyone. If you have questions about this and you want to talk to either of these ladies or anyone at DRH Imaging, you can give them a call, and they'd all be really glad to talk to you. So, thank you, and we'll see you next month.